Hello, everyone. I'm Dr. Susan Slovin. I am a genitourinary medical oncologist at the Sidney Kimmel Center for Prostate and Urologic Cancers at Memorial Sloan Kettering Cancer Center in New York. Patients often will present to the office with the greatest stress of their life, which is my PSA is elevated. Now, there are two circumstances in which PSAs can be elevated. One is at the time of diagnosis or following a particular primary treatment or even subsequent treatment. So I very often kid with my patients and say that PSA, while standing for prostate-specific antigen, a biomarker in the blood that tells us that something is going on with the prostate, it also stands for promotes stress and anxiety, both in the doctor and in the patient as well. So one of the issues is that at diagnosis, there are what we call norms. There's a range of how high the PSA should be in a young man versus an old man. Now, excuse me, PSAs can be elevated from a number of medical problems. Number one, excuse me, prostatitis, which is an inflammation, can be seen as early as the college years and might be causing vacillations in PSA. Having sexual relations can also cause a rise in PSA. Sitting does not cause a rise in PSA, nor does a digital rectal examination cause an elevation in PSA. In order to really have a high PSA, you really would need to do Tour de France cycling. So I would tell you right now that cycling does not cause an elevation in the PSA. And the last one, which can cause, is what we call benign prostatic enlargement. It's essentially the equivalent of what a woman has with a fibroid. It's benign muscle tissue that's within the gland, and you can see it go up and down. So cancer is one reason. BPH, or benign prostatic enlargement, or prostatitis, or recent intercourse, all are reasons for having an elevated PSA. And of course, when you have issues with regards to elevations or PSA, as either indicated by your primary care doctor, this does warrant a visit to the urologist. In fact, I try to ask patients, are you having any change, not only in erectile function, but in the change in the quality or quantity of semen, or pain on ejaculation, thinning of the semen? None of these are really diagnostic for prostate cancer, but very often men will say, well, I just thought all of these were symptoms that were related to my advancing age. And the reality is that's not the case. And anything like this should be directed to a urologist just to make sure that there's nothing abnormal that is going on. If you have had primary therapy with surgery or radiation, a rise in PSA, what we often call a biochemical relapse. Biochemical referring to the fact that the body is producing a chemical. Now, the chemical is PSA. Now you say to me, how can that be? My prostate was removed. In spite of the best doctors and in spite of the best techniques that we now have, cancer cells can escape. They can escape from the prostate even before the surgery or radiation is started. And when that happens, for example, after surgery, it indicates, number one, that there is likely that there might be microscopic disease still left behind, for which salvage radiation, with or without hormonal therapy, might be very reasonable. However, just to give you an idea, a rising PSA in general, even before you've had prior surgery and before you have any knowledge of these medical conditions, usually implies activity. Now, what's the extent of the activity? It depends, of course, on the clinical situation. So if a man has just had relations, clearly a rise in the PSA is due to that. But if you've had surgery and you've had radiations and all of a sudden your PSA is starting to rise consistently, it usually means that the disease has returned It is not indicative of a poor prognosis. It just means that there's likely either microscopic disease left behind or microscopic cells are floating around, and those are the reasons for the PSA being elevated. And there's a lot of things to do for this kind of predicament. But in general, all I can tell you is that it just means that the disease is active. A PSA that rises from 2 to 4 does not mean that you have twice the amount of disease at 4 compared with 2. It just tells you something is going on. And if unchecked, it could lead to changes on imaging down the line. So please keep in mind that yes, it does promote stress and anxiety, but on the other hand, all it's doing is telling us that we need to be mindful that something is going to change. And that is what you need to do in terms of following up with your oncologist or your radiation or urology doctors.